We welcome you today to discuss a vastly different world than the one we imagined just a few months ago. We are in the midst of a pandemic that has upended life as we know it and a racial reckoning that is long overdue. The magnitude of the coronavirus pandemic is shining a spotlight on the importance of schools as community anchors that children and families rely on for so much more than an education. It is also exposed to the vast inequities on which our education and health system are built. More than 56 million children attending elementary, middle, and high school will start their studies at home this fall. They will all encounter academic, social, and emotional challenges. Wealthier parents will counter this with homeschooling pods and private tutors. Other families, including the 30 million children who rely on school meals, will face a learning environment with growing inequities. In addition, children with disabilities, learning differences, or behavioral issues are at greater risk of not receiving crucial services or supports. Instead of offering a safe and measured plan to address these inequities, President Trump encouraged states to withhold funding from schools that don't open on schedule. This is a moral outrage. Across the country, we are hearing from school superintendents who know that they do not have the resources to open schools safely. Governors whose requests for support have gone unanswered. Teachers who want to be with their students but have vulnerable family members, and parents who are afraid of sending their children to school and are worried about the long-term trauma facing their families. And everybody knows someone who has been impacted by COVID-19. This is what we have come to as a country. There is no national vision, no comprehensive plan to help schools reopen safely. There are no plans to protect the most vulnerable or to provide assistance to the children and families most affected by the spread of the virus. Instead, each day creates new uncertainty and fear. The infrastructure designed to support our children's educational and health needs and the needs of families and communities have failed spectacularly. We have not invested equitably in school facilities or in school nurses and social workers. School districts are trying to do their best for their students, but without support or resources, they are being set up for failure. This is a pivotal moment in our nation's history. Amidst these massive and simultaneous failings, we must rise to the challenge of fundamentally rebuilding these systems. This is our opportunity to make changes for the long term, an opportunity to change for good. The title of today's event is also the framework for a set of recommendations we are developing to rethink the education system, including the services it provides beyond the essential task of teaching our children. Some of these ideas are not new. In fact, they've been championed by organizations and communities for years. But now is the time to act and work together. Healthy Schools campaign brings an important perspective through our work at the intersection of health, education, community, sustainability. And this is where we think we can have a big impact and be an important partner and ally. We are calling for increased federal investment and cross-sector solutions that accurately reflect the importance of our country's public schools. The pandemic has highlighted vast inequities, both in terms of health disparities that disproportionately affect communities of color and the unequal educational resources schools and communities have on hand to meet the immediate needs brought on by the pandemic. Change for Good imagines an education system with health and equity at the center. First, We need federal investment to rebuild America's schools. Too many students are learning in crumbling and unsafe buildings, and the outdoor spaces at our nation's schools are in terrible disrepair as well. A recent report shows that 54% of school districts must replace or repair major systems. This is the level of disinvestment we must address, starting with our most underserved communities. We are very proud of Space to Grow, our innovative partnership to rebuild schoolyards and through green stormwater infrastructure make Chicago's communities more resilient to the effects of climate change. Historically, there has been almost no federal funding for school facilities, but now it is the time to make an unprecedented investment in school facilities. And we can do that in a way that both protects children's health and makes our communities more resilient. We also must rebuild school health services. Schools are an important part of the healthcare system, particularly for our nation's most vulnerable children. Yet the burden of paying for physical and behavioral health services in schools has largely fallen on the education sector. We have helped states expand Medicaid-funded school health services, and we know that access to health services is key to helping students thrive. The federal government should incentivize the expansion of school health services by increasing its Medicaid contributions to states to cover health services delivered in schools. We must change the way schools are funded at every level of government in a way that accounts for the impact of poverty and structural racism. There can be no equity when the wealthiest districts receive thousands more per student than the poorest districts. We need to go beyond equal funding. Students in poverty and from historically underinvested communities must need more funding than those in wealthier communities. We call on the next administration to support states, districts, and schools in developing new approaches to creating adequate and equitable funding for schools. Finally, we must restructure how we procure and distribute school food. Hunger and food insecurity are significant and growing issues, and schools are an important setting for addressing these crises. It's simply good public policy to offer free and nutritious school meals for all students. Doing so ensures equitable access and reduces barriers to national school lunch and breakfast programs. We look forward to sharing more details about this important work in the coming weeks. We have submitted recommendations to both presidential campaigns, emphasizing what the next administration can do on day one to improve student health and the health of our nation. This moment requires the bold thinking and pragmatic action that Healthy Schools Campaign is known for. Our organization has a 20-year history of working in partnership to develop successful programs and advocate for policies at the local, state, and national levels. We also have deeply rooted connections to local schools and grassroots leaders. The world we find ourselves in is not the world our children are destined for. This is our moment to strengthen schools and to rethink and rebuild our education system for the long term. A significant investment in schools would boost the national economic recovery, show that our country understands the value of public education, and create lasting change in every community. So let's ask ourselves, what if we don't go back to the way things were? What if we create an education system that centers racial justice and equity? What if we remove barriers to healthcare for students so that they can be healthier and focused on learning? What if we invest in school buildings and schoolyards that support both children's health and the environment? What if we make healthful food available to all students? In other words, what if our education system changed for good? This is our moment to demand these changes. We hope that you will join us. Thank you.